Go to this now. Childline South Africa is launching a Mental Health Matters for Kids campaign in schools. And up to 65% of children and youth aged between 10 and 24 are struggling with mental health related issues but aren't seeking help. Now, the latest UNICEF U-report poll indicated poverty, the COVID-19 pandemic, and a sense of hopelessness that are the key factors impacting mental health in the youth. To tell us more on this is Childline Mental Health Matters for Kids Project Head, Neli Manzi. Good morning, Neli. Thank you so much for joining us. Now, we know that we just mentioned COVID-19 pandemic has had a huge impact on the mental well-being of not just adults in South Africa, but also our children. And in this country, there are also so many other factors that play a role in mental well-being of kids. But let's first discuss what's been discovered in the UNICEF's latest U-report poll and the severity of this issue in South Africa.
Yes, good morning. It is very alarming how COVID-19 has impacted youth and children in South Africa. As you know, the UN poll was done for children and youth between the ages of 10 and 24. And what they found was that the respondents actually, the total average was that 64% of those children and youth admitted to saying they were actually struggling with a mental health issue, but none of them had actually sought help because they were either too scared or they were nervous about the stigma that is attached to that. So 64% from that UNICEF U poll is quite alarming. And interestingly, Childline, who is a big partner in the Mental Health Matters for Kids campaign that we're talking about this morning, they've also found a huge and significant increase in terms of their calls that children and youth make to them on a daily basis since the advent of COVID-19. They've actually reported that emotional abuse calls in their call center has increased by up to 170% since COVID-19. Domestic violence calls by 159%. Family relationship problems by 280%. Suicidal feelings in children and youth by 132%. And the final one I'll just discuss with you, psychological health has actually deteriorated, and they've found calls are saying 227% increase in psychological health issues when it comes to the children that call Childline.
Wow, those numbers are very scary, Neli. But how do we end this stigma around mental health issues?
I think that is really what we are trying to do by educating learners in schools through the Mental Health Matters for Kids campaign. So generally this campaign is a partnership between our organization, Paradigms Wellness, as well as Childline, who are going to be one of the very big implementing agencies when it comes to this campaign, where we are going into schools, primary schools and high schools, and broadcasting a talk done by a Childline training specialist, Phakeme Mahlangu, a talk done by a child psychologist, and a talk done by a motivational speaker, Moho Mhlaivane, who specializes in children. And we are going into schools to tell them about mental health issues. The first talk focuses on how are they doing. The second by the psychologist focuses on giving them the coping skills that they during this very trying time. And the third talk is a motivational talk, just to show children that they can still dream again, just to help them bounce back from the many setbacks a lot of children have experienced during this time.